We're here today to talk about B12 deficiency in IBD because that's quite a common thing. And I'm Sahara from IBDSuperHeroes. That's Annie from IBDSuperHeroes, and that's Roger from IBDSuperHeroes. And they both have B12 deficiency, which is what we're going to talk about. And that's why they're here. So I want to know how long each of you has been diagnosed with B12 deficiency. Roger?
I was diagnosed with Crohn's when I was 17. Actual being diagnosed with B12 deficiency was probably about when I had my first stop about 2000. What's that? 21 years ish.
21 years ago.
Yeah.
Okay, that's madness.
Seems like a long time. Yeah.
And that is why you are both here, because 21 years is crazy. How about you, Annie?
Yeah.
As long as Corey, so
4'7". I can't do professional.
I don't think any of us can do professional. I've been plugging coffee very loudly, so probably how it's going to continue. So diagnosis now is a simple blood test. I assume it was the same 21 years ago.
Yes, yeah, I guess so. Yeah.
Roger can't really remember because it was that long ago. So I'll start with Roger. What symptoms led to you being tested for the deficiency in the first place? Or was it simply because you'd had a surgery that might make you deficient, so they thought they'd check?
Again, as I say, I don't take a lot of my treatment seriously. I don't take a lot of anything seriously. It was probably basically because I was just feeling like poop, lethargic, lazy, no energy, lots of fatigue, and I assume
lots of words that describe tired.
Yeah, yeah. So I guess it all come about because of all that, you know. I had lots of iron tablets that, you know, didn't make a lot of sense and weren't working. Yeah.
So you were already like
again?
So you were already anemic, and it was a case of you still felt like crap, so then they did the you think this is what happened.
Yes, yes. That's it.
According to my memory. And Annie, how about you? What symptoms led to you being tested? Oh, you had the surgery as well, so was it a case of
I hadn't had
the surgery
so
they tested? Oh, so it was before.
Yeah, because I'd had terminal ileum disease, but obviously because I just gave birth and they were just like, oh, you're a new mom. That is why you're tired, but we'll give you these iron tablets anyway. And then it took ages after the B12 blood test. And then, yeah, the loading dose, which I think is 5 tablets, 5 injections over the space of 2 weeks.
Oh, wow.
I never remembered having any sort of loading dose. I might have done, but I don't actually remember it.
Have you slept in the last 20 years, yeah?
Yeah. So I remember me Humira having loading doses because that was kind of 4 injections, but I don't remember the B12 having a loading dose. Don't remember.
I genuinely didn't know that there were loading doses for B12 either. I just thought it was something like with your iron, if you start iron tablets, you just start, it's not like you take a lot of them and then a normal dose, is it? So no, I genuinely didn't know that that was a thing.
No.
See, learned something new today, which I wouldn't have learned from Roger because it was 21 years ago.
And we were little babies at that stage.
Did anybody sit down and explain to you about why you might be deficient in B12? Because obviously we know at this point that people with Crohn's disease, it's quite common in any way, depending on where the disease is. And like you mentioned, it's the certain part of the intestine. So like the lower end of the small intestine is where the B12 tends to get absorbed. So people with Crohn's in that area tend to be deficient in B12, or people that have had surgery to remove that part are often deficient in B12. But did anybody actually sit and explain that to you?
Nope. No.
No.
So
It was literally just a case of, I think for me, I learnt it myself later on.
Was that like a Google thing or something that you learned in the community?
Yeah, it's more the community, I think, because she told me, oh, it's because of your Crohn's, but nobody said why or where the B12's absorbed or anything else. So it was just a case of that's all the information I got from my GP. I never got anything from my consultant side, and then everything else I've learned later on in life, community.
So you seem to say it a lot, that like nobody actually sits down and explains things to us. And I genuinely think that it would be so helpful. I'd appreciate it if somebody explained to me what I was being given these certain drugs for and stuff. Like I have learned everything myself, and I've come home and I've been on Google and looked at like obviously decent sources of information and asked in the community and stuff. But it would be nice if a GP or a gastro sat down and explained these things to you. So B12 is obviously administered via injection. COVID aside, what is the usual process for your injections? Now, Roger blew my mind with what he used to do. So, Roger, tell us about your the process that you used to go through.
I'm meant to have my B12 every 3 months. Obviously, with COVID, I've let it lapse because they've got better things to do. Originally, with my B12 injections, not now because I've changed GPs. With my old GPs, I used to have my B12 vials on my prescription. So I take my prescription to my chemist and they'd give me a box of 5 B12 vials, and I'd take them home and put them with my cheese slices in the fridge. And it's not in the red, so it's not unusual. So I'd have about 3 or 4 of them. Come the 5th one, 9 times out of 10, it was out of date. I used to bin it and go back to the doctors and say, I need a B12. And I will say, it's not on your repeats. You have to go and see the doctor and everything else. But now they have the B12 vials at the doctors, at the GPs. So you just book up an appointment, go to your GP and they give it to you, and off you pop again for 3 months.
And you have to arrange your own, don't you? Like through both GPs, you've had to like every 3 months arrange your own. Because I only think about things like obviously with my azathioprine bloods and stuff, like they always used to send for me, and I assumed that that was going to be the case with B12 injections. So you having to book your own blew my mind a bit, and then with having your own vials from the chemist and keeping them with your cheese slices.
Yeah.
I used to do that.
So did you do that as well?
When I was first told, yeah, it's only since I moved here 5 years ago, and then I turned up with my vial and she was like, you don't need to do this. And I was like, oh, okay, but here you go anyway. But they stopped doing the 5 in the box and slowly brought it down to 1 because I think they realised that it was actually just ridiculous to have 5 vials in a box. And so I'd have a ginormous box for this one vial, just like waving around in it.
So do you have to book yours, or do they call for you? It's standard procedure for B12 for the patient to book.
Yeah, you book yourself.
Even when I was on
you forget you're a person with IBD and fatigue and brain fog. What if you
at times I'd turn up a month late or something and be like, I'd think, why am I so tired this month? And then I'd be like looking through my diary or trying to like go online and look through all my appointments that I've had over the last 3-4 months. And I'm like, oh, that's when I have my B12. Oh, hi, I need to book my B12. When was you due? A month ago.
So is it
so
always
then they
3
try
months
and get me in really quick.
Yeah, is it always 3 months?
It can be.
I didn't know whether there was. I wasn't sure whether there was. That's what I was thinking. I didn't know whether there was like a point where somebody might need it every 4 months or someone might need it every 2. Is that when you first diagnosed? Is there like a monitoring stage where they see how fast it drops or something?
They can monitor it and they can put you up to every 2 months, which I've asked for, but they've kind of gone, no, you're all right. But yeah, I'd like one every 2 months if I was honest. I'll probably feel a bit better.
Yeah, so you feel like for the last month you're waiting and feel rubbish.
Yeah, you definitely feel it on the last month. They did actually try me every 8 weeks for 3-4 months, and then they realised that that was making my levels too high. So they had to kind of find a middle, and so now it's every like 10-11 weeks rather than 12 weeks. But You
So
definitely
it is
feel
very
it when
much
you
trial
do.
and error then to get your spacing right, schedule
Yeah.
spacing. Cool. I am genuinely interested. Like, I would assume that other people would be as well. So did you get any side effects from the injections?
No.
Get sore arm for a few hours afterwards, or a day or so. That's it.
Is it always in your arm?
Yeah.
Yeah. I don't get a sore arm, I don't think. I know that, like, I always dread
Saying I'm
having it
listening.
done. I know, like, I always prepare myself for the actual injection because it is more painful, and I was told that it's more painful because the liquid's quite thick, so
And
that's the only
they
reason
use
why.
quite a large thickness of needle as well, apparently. So one
Yeah.
of the nurses told me once, yeah.
So because of that, it does hurt. Like, it's not unbearable pain. It's just more than like a flu jab. So then when I did go for my flu jab, I'm like, right, prepare. And I was like, oh, that's weird. But because I've spent so many years being used to the B12 injection, that any other injection, I'm like, breathe.
So do you
And then you feel
feel,
absolutely nothing.
can you tell the difference as soon as you've had it, or is it like a gradual thing, or?
Couple of days after with me,
Yeah.
I find I'm kind of way back up.
Within 24 to 48 hours, yeah, you feel a difference. Like, I know for me, when I'm due, I get really bad restless leg syndrome as well. So I'm up all night kicking and my arms are flailing about all night. Then as soon as I have my injection, I'm finally like a bit more relaxed.
That's good. That's good. I was looking earlier on the NHS website at like the general symptoms and stuff. And there are a few different words for tiredness here too, Roger. So that should make you feel better.
That's where Roger got the list from. He sat there and memorised lethargic.
I'm going to read them to you now in the 2 minutes and 35 seconds that we've got left. Extreme tiredness, fatigue, it's in brackets, lack of energy, lethargic is in brackets at the end, breathlessness, feeling faint, headaches, pale skin, noticeable heartbeats, palpitations, hearing sounds coming from inside the body rather than outside, tinnitus, pale yellow tinge to your skin, mouth ulcers, sore red tongue, pins and needles, changes in the way that you walk and move around, disturbed vision, irritability. I think I've got B12 deficiency.
That's just because you haven't got no electric. Sorry.
Depression, changes in the way you think, feel and behave, and a decline in your mental abilities such as memory, understanding and judgment. So like a lot of the things that people with IBD would experience anyway, so it's probably quite difficult to even notice sometimes that, I mean, if you're only experiencing a couple of the symptoms and you already deal with like fatigue and stuff on a daily basis and what we call brain fog and stuff, probably worth getting checked if you feel a bit additionally crap, I guess.
See, my last B12 injection was August, and a lot of them symptoms.
A little bit overdue.
Yeah, a little bit overdue. A lot of them symptoms you've just reeled off now, I am getting now. Yeah.
See, I don't think sometimes that we realise until you actually see what they are, that, oh, actually, that's caused by, I mean, I've had some really, really weird symptoms and felt really, really rubbish. And sometimes, a lot of time it's been down to dehydration, which is very, very simple, but causes a lot of issues. And I guess B12 is the same.
You really should have your B12 though. Like, I got a letter at the start of lockdown saying that B12 injections were going to stop for people with like dietary needs, but for people like me who don't actually have an ileum, they're just going to carry on the injection. So that's fine. I've still been having mine.
So I'm sure if I phoned up my GP, they'd be going, "Come up and get it," you know. But you know, that means me going out, and I'm not a fan of going out right now. I've got to be honest.
Well, I'm pretty sure we're going to run out of time in like seconds, so I'm going to say thank you now for sharing your experiences before we cut off halfway through, and that's it. Thank you, and I hope it was useful.